Hi, it's Gary Chimes from Lake Washington Sports and Spine, and I want to talk about proxy variables and how it affects the way people have discussions about health outcomes. I'll hear people talk or read articles that talk about how they're trying to improve health outcomes for a population, and they'll often, kind of hide what they're really talking about, which is cost containment. And cost containment isn't a health outcome. So what do I mean by that? And a health outcome is that you're healthier. Remember, health is not the absence of disease. Health is a robustness that allows you to withstand disease. And we think about like someone actually being healthier, what are we talking about them? We're talking about them being able to play more, them being able to run or play tennis or play with their kids. We're talking about them, their ability to do work. We're talking about them being able to do their activities of daily living. Are they able to take care of themselves at home? Those are actual health outcomes. Now, those things are sometimes hard to measure, so we'll sometimes use proxies. Now, when you're hearing about people using a proxy measure means that you can't measure the thing that you want to actually measure easily, so you measure something else. A classic proxy measure would be in diabetes management when you measure blood glucose levels or hemoglobin A1Cs. What we care about with diabetes is the health outcomes associated with diabetes. Are you getting diabetic retinopathy? Are you having problems with your kidneys? Are you having problems with your nerves? Diabetic neuropathy? Are you having problems with increased heart attacks or other risks? That's what we care about with diabetes, but that's harder to measure because we don't have an absolute predictor measure. So we look at things like blood sugars and hemoglobin A1C as a proxy to try to make an estimation about the outcome. But the reason I bring this up is that sometimes people get so focused on the proxy they forget that that's not even what we really care about. The proxy is a tool to measure the thing that we actually care about. Now, where I really want to get into this is that when you hear people talking about health outcomes, there's a litmus test that is platitudinous bullshit. And that's if they start talking about limiting diagnostics, okay? Because limiting diagnostics is a way to lower cost, and that might have virtue in of itself, but that is not a health outcome. If you're looking at a population of people from Seattle or Pittsburgh or Arkansas or New Jersey or Chicago or these other places I practiced, and you say, well, this population has fewer MRIs ordered, that tells you absolutely nothing about whether it's healthier. It might tell you that maybe you're spending less money per person, and maybe a healthcare system wants to spend less money per person, but they frame that as good healthcare. That's bullshit. It's not good healthcare. It's trying to limit their expenditures. And I just hear that used so often. Okay. Now, the argument I'll hear people make is that, well, having an MRI doesn't necessarily make the person better. That's true. But having an MRI doesn't necessarily make somebody worse either. So number of MRIs ordered per patient isn't a measure of a healthier population. And what I would say is when you're looking at diagnostics are often very useful tools to understand people. Just like, let's say, going back to the diabetes example, a hemoglobin A1C isn't itself a healthcare metric, but it is correlated with things that actually are functional. So I wouldn't say that you're doing great diabetes management if you limit the number of hemoglobin A1C tests that you order. That would be bullshit. So I think whenever you're listening to discussions about healthcare and you hear people try to sneak in about how they're spending less money and saying that's good health outcomes, that's bullshit. This is Gary Chimes from Lake Washington Sports and Spine. Thanks.